Hey, what's up guys? I've decided that since it's 1 o'clock in the morning and I've taken some Z-Quil to try to sleep and it has yet to kick in, I should film a video, because that makes sense, right? That, being under the influence of a sleep aid while also being severely sleep deprived, my brain function is at its peak. I just wanted to make a quick little video basically like warning you guys of what might come and also to explain past behavior. I think a lot of you know that I have dealt with depression, but it has gotten a lot worse in the last few months, which is fun. So I have tried tons of different methods of dealing with it. I see a therapist every week, and I have for a very long time now. I've tried multiple different drugs, antidepressants, to, work that out. I exercise, eat healthy, whatever. Nothing seems to work long term. I eventually end back up where I am now, which is in the pit of despair. But I'm great at throwing on a character for the camera, and also it's, a way to cope is to laugh at it. But it's not funny, because this week has sucked. It is currently, well, it was Friday night, I guess now it's Saturday morning for people who like to get technical. But I haven't been able to do anything but lay on the couch and watch YouTube or The Office, which The Office is my go-to show when it comes to wanting to shut my brain off and just go completely numb. This is the first day I've even been able to, move around. The fact that I even set my camera up was like a physical feat of itself to do anything whatsoever. So I saw a different psychiatrist today who specializes in something called TMS. TMS stands for transcranial magnetic stimulation. Essentially, it is like a magnet that they put on your skull, usually on the left, it's on the left side, and it's the portion of your brain that controls serotonin, norepinephrine, and dopamine, basically the center of your brain that goes haywire when you're depressed. So it literally is like a magnet that sends pulses into that one little part of your brain that activates it. It's essentially supposed to retrain your brain, teach it how to function like a normal brain. It just hits reset. And I've looked into this, and there's really the only side effects are that it'll irritate my scalp. To have something there. I would have to go every day, 5 days a week, for anywhere between 30 to 40 days. So I don't know how long it would really take, because I could start seeing improvements after 20 treatments. I may not see improvements until friggin' next year, but usually the average is about 36 treatments is when people are done. And then there's always a chance of relapse in the future, but you just go back and get it done again. And it's apparently even when you relapse, it's not as bad as it used to be. And every time you get a treatment, if you have to, your relapses are not as hard, or they're less often and stuff like that. So even then, it's it's still sort of a more permanent solution. And the only side effect is that it irritates your scalp. I've looked into it, and there's no chance of it making it worse or whatever. And I think it sounds incredible. I know, a lot of people have issues with insurance, but part of the reason I wanted to be, vulnerable online or whatever is, I think it's important because I had never heard of TMS. And apparently it's been around since 2008 was when the FDA approved it, and it started, being used in circulation. And I studied psychology. I just graduated last year, and it never came up. We talked about medications and stuff, but no one ever brought this up. And looking into it, I was given a cute little pamphlet today. That's gonna be me, my cute little hat. But anyway, what was I saying? This is part of it. I can't freaking think. I can't use my brain. I can't remember anything. I can't keep a train of thought. I can't sleep. And then when I do fall asleep, I can't freaking wake up. And while I'm asleep, I'm having stress dreams. And all I can do is stare at a TV or stare at my phone and just zone the heck out, which is great. So this whole thing I'm doing right here, trying to keep one train of thought, is so difficult right now. Basically, I think it's something that if you are like me and you have dealt with depression and you have tried, I would say about 3 or more medications, even 2 or more. I learned today that after you try about 3 medications for depression, it's very unlikely that a 4th is going to work, or a 5th or 6th. The more you try, the less likely the next is going to be effective. So if you've tried, at least a couple of methods of treating your depression and it's not worked, maybe ask a healthcare provider about TMS. And I'm not sponsored or anything. I've never heard of it, and it's like such a low risk thing. All of that to say, other than encouraging anybody who wants to look into it, to ask somebody about it. But also this is to explain why I used to be super consistent with posting every week and why I haven't been doing that since friggin' almost like the summer of last year. I started getting kind of bad at that. But you know, especially more recently, I've been posting very irregularly. And I've been bad at keeping up with promises that I've made to like Patreons and things like that. And basically this is why. And if my content is more cynical or less fun to watch, this is why. And I'm trying, but you can try all you want sometimes. You just can't make yourself better in some cases. So, I am seeking something that hopefully will help, but in the meantime, basically, I'm asking for patience. I mean, that's it. I'm just explaining why things have been the way they have, and also explaining why they might continue to stay bad for a little while until hopefully the treatment starts to work. And also to take a load off of me, so that way I've explained to you guys why I may not post at a regular time, or maybe don't post for a week. Also, if you guys send me messages, just know that I appreciate it and that it's sweet, and I don't have emotional, social energy to respond to it, and I'm sorry, and that's not fair to you, but that's the truth, and so I want you to know that. That's not that I don't appreciate it. So yeah, check out TMS if that sounds interesting to you. I might document my experience with it, and then share it with you guys later and see, you know, if it worked and how well it worked, if it did, and which it seems like it's going to do something. I don't think it's going to do nothing. And it's a little bit of hope, you know, it's not just another pill in a blind shot in the dark. It's something that's directly targeting the part of my brain that's malfunctioning. And please be patient with me as I try. Anyway, thank you for watching, and I'll see you in the next one. Peace.